We're a large cardiology practice with several locations and close to 30 cardiologists. We have been around for about 5 years, and over time we've had our growing pains. We realized that we're spending a lot of time doing redundant work. There was some unhappiness among both cardiologists and staff related to communication, making sure that everybody's on the same page. Cardiologists felt that a lot of the times through the clinic they were either busy and behind the schedule, or were sitting and waiting for the patients to come, and the patients just weren't ready on time. From the patient perspective, we had long wait lists to get patients into the clinic. When in the clinic, patients had to wait in excess of an hour or two to see their cardiologist, even if they came on time. And we really felt strongly that we had to correct these issues. So we embarked on the lean process about a year ago, and we took a multi-pronged approach, which included getting everybody together, both the staff and the cardiologists, to come up with a mission statement for PACE and what we stand for. That brought the group together. We ensured that communication was improved and that now everybody was more or less on the same page. But more importantly, we've had a number of meetings addressing each and every area of work in PACE, and walking through the workflow of the different professionals at PACE. We have administrative staff, we have technologists who do anything from ECGs, Holters, loop event recorders, stress tests, stress echoes, echocardiograms, etc. And obviously we have physicians. And while we're a largely cardiology practice, we have cardiologists, we have internists, we have pediatric cardiologists, etc. And what we found was that there was a lot of unnecessary work being done. For instance, patients who were scheduled to have certain investigations did not have them done before their next scheduled visit. We didn't realize that they didn't have it done until very close to that visit, and in some cases had to cancel the visit in order to get those investigations done, resulting in significant problems for the patients, and in some cases for cardiologists to make sure that the clinics were full and fully booked. We also found that during the flow of patients through the office, we had patients coming in waves. In essence, at the beginning of the day and at the beginning of the afternoon, we had about 25, 30 patients show up all at once, and not enough capacity to see these patients in that hour. And in fact, this wave then distorted the rest of the day. So we identified these problems and used lean methodology to work on these problems as kind of root issues behind our wait lists, behind the flow problems in the clinic, etc. The way we addressed these problems was to eliminate certain bottlenecks that we found in the clinic, combining certain stations patients had to go through, stations where patients had their history taken and ECG were combined into one step instead of two separate steps, which previously were bottlenecking each other. We also changed the way we book and currently use the wheel booking model where slots are inserted into the schedule and patients are spread out. At the end of the day, we see the same number of patients per clinic per day, but those patients are spread out, and so we don't have to see them all at once. We've eliminated these huge waves, kind of ups and downs of the patient flow in the clinic. And with that, we have also incorporated KPIs, so key performance indicators, in evaluating our progress, and found that the patient time in clinic waiting for the physician has plummeted dramatically from over 2 hours to under an hour over the last 3 to 4 months. We have also been able to largely eliminate our wait lists for patients coming in for general cardiology appointments and for testing. At this point, a patient can see a cardiologist within 2 or 3 weeks for a non-urgent elective referral, and patients referred from the emergency room get seen within 72 hours. We're able to offer cardiac testing such as echocardiography, stress testing, stress echocardiography within a few days to a week to most of our patients, at least at our new market location. We looked at key performance indicators relating to how long patients had to wait for their return visit. Historically, we found that before undergoing lean, patients who were supposed to be seen at 3 months were not seen until 6 or 9 months later. And we have been able to correct it. Looking at the last 6 months, we find that patients were generally seen within the period of time plus 10 to 12 days beyond their period of time. So if somebody's supposed to be seen in 3 months, 90% of these patients are seen within 3 months plus 12 days, which is also a significant improvement on the way things used to be before Lean was implemented. At the end of the day, physicians were a lot happier. They no longer had to either wait for the patients to arrive. They're no longer behind by an hour or two at the end of their clinic. They're right on time. When I finish a clinic now, all of my work is done. The tests are all reported. The letters are all sent to the referring physicians. And effectively, I walk out of the clinic the same time as my last patient is walking out of the clinic without having any work left over after that patient is seen. And that patient is typically walking out of the clinic within about a half an hour to 45 minutes of when their appointment was scheduled for. We are getting very positive feedback, both from our patients and increasingly from our referring physicians as well, related to decreased wait times for appointments and decreased times patients have to wait to see a cardiologist when in clinic. Initially, we had our growing pains, and when PACE started, we certainly had significant wait list and significant flow issues within the clinic, which following implementation of the Lean recommendations have been largely eliminated. It's very important to consider that Lean is a group effort. It's very important to involve cardiologists and staff, make sure that everybody's on the same page. It's very important to make sure that you have the electronic backup and an electronic medical record system in place that allows you to implement Lean recommendations and offload the redundant work, as well as be able to keep track of your key performance indicators. To be able to work with one of the Lean consultants and to properly go through the process, first of all, you have to be ready to implement the recommendations. You have to be ready to be fully transparent about practices with your staff, your cardiologists, other physicians, your referring physicians, your patients, etc. In fact, one of the very important things that we've done is we've involved some of our patients in the working groups that got together as part of the Lean process and got patient feedback incorporated into the Lean recommendations, as well as into the mission statement developed for PACE. I think mission statement is very important. Again, it brings everybody together and everybody can measure up what they do on a day-to-day basis against the mission statement for the company, which needs to be developed and then looked at periodically by all the staff working at the clinic. The Lean process did bring all of our staff together. There were significant issues related to lack of proper communication between physicians and staff, between the company and staff. There was no clear understanding as to where the company is going by all those staff. Lean process and among other things, we have started to do Huddle Sessions, which happen every day at the Huddle board. Any of the new initiatives and processes, as well as key performance indicators, are tracked on the Huddle board. We found that this made a significant difference to making sure that everybody's on the same page and everybody understands where the company is going and what the company is working on a day-to-day basis, as well as where we see us in the future. Our staff had excellent, exceptional work ethic and have been working very hard from the beginning and throughout PACE history. We just found that they became more efficient, not necessarily that they became any more productive in a sense that they were already very productive in the first place, but it certainly became much more efficient with elimination of a lot of extra work and redundant work.